welcome everybody. It's really lovely to see your faces again. And as you know, many of you, we've been working with Shilan Tian, who is our one of our campaign organizers, and she's been working with the Chinese community. And so we have translation in Mandarin today. Thank you very much, Wei, for doing the translation, and Shulin. And so you'll see when I show the slides, they're both in English and then also Chinese, and that's why. And so we have simultaneous translation going on tonight. So there are about 250, 270 or close to 300 people registered. Not everyone is in right now, but I'm going to get started anyway, because I think we'll aim to sort of keep the meeting to an hour or very close to an hour. And I really just want to kind of run through with you a briefing on kind of the political context that we're facing right now. Obviously, we are in extraordinary times, and this is an extraordinary federal election. And the issues regarding domestic policy, so, that is all of our tax and transfer system, our public services, and so on, really haven't been front and center on the radar of people during this election. Mostly people have been thinking about foreign policy, about trade, about defense policy, about our place in the world and our relationships with other countries, key issues. And then also the private sector, what's happening to the auto industry, the steel industry, the other industries hit by tariffs. And these are all key things. So too, and in fact, even more now, given the economic climate and given the job losses that have already started in Canada, our social programs and services are vitally important. And so I'm really happy to see all of you here today, because we need to talk about these issues in this federal election, and we need to get some clear commitments from the political parties on the ones for which we don't really have clarity yet. And we need to push very hard, particularly given the context in which a number of the provincial governments are, really hell-bent on privatizing public health care. So I'm going to run through a briefing on the key issues, where the parties stand on those issues to date, where the key political parties stand on those issues, then some key messages and facts and things, and the materials that we're providing for the federal election, and then open it up to questions and answers. The briefing won't be super long, okay? So I'm gonna just get started right now. I'm gonna share my screen, and I'm going to run through just a quick kind of slideshow and also show you some other documents. I'm just waiting for the slideshow to start. Okay, this is just the translation information. And so, what we're asking people to do is, in addition to those issues that are top of mind right now, tariffs, trade policy, defense policy, Canada's place in the world, all of those things obviously matter, but there really is no economy for you if you have to spend all of your savings to pay for your surgery or your cancer drugs. And that is in fact happening to Canadians, although it shouldn't. And so we have public Medicares that are laws that are supposed to protect us from user fees. We have new expansions to pharmacare in Canada, and I'm going to talk with you a little bit about those. But the federal government has a key role in upholding those policies and protecting Canadians. The key issues that we've identified in healthcare in this election are just four, really. We're trying to keep it quite simple. One is enforce the Canada Health Act, which bans user fees for medically necessary hospital and physician services. So everyone has the right to healthcare based on our medical need, not based on how wealthy we are. You are not allowed to sell queue jumping for the rich. We provide healthcare on principles in Canada, and no private clinic or public hospital is allowed to charge a patient for a medically needed surgery or diagnostic test. That's whether or not that surgery or diagnostic test is done in a hospital or a freestanding clinic. Similarly, you are not allowed to charge anyone for a doctor's visit or indeed for the similar service if it's provided by another health professional, such as a nurse practitioner. Under our public Medicare laws in Canada, that should never happen. But as we know, it is happening. And we have to demand that the federal government uphold the Canada Health Act, and with it, the protections for patients against user fees and extra billing. As Justice Emmett Hall, who was in fact a conservative judge who was appointed by Diefenbaker, but chaired the commission on that led to the creation of public Medicare in Canada, said, the pain of being ill and of dying is burden enough for people to bear without the added suffering by financial hardship, just at the point when a person needs care the most. As Canadians, we agreed to pool our money in our taxes and pay ahead of a time so that healthcare would be there for us when we need it. And so those prohibitions on extra user fees and extra billing for patients are cornerstone to public Medicare in Canada. And we have to uphold what we won when we won public Medicare. That is really under threat now, particularly with the incursion of private for-profit clinics. The second issue is stopping for-profit healthcare in seniors' care. So many of you will have been paying attention when the federal government actually brought in the new child care program, universal daycare program in Canada. They attached the program to 80% provision of it had to be nonprofit. And the provinces signed on to that, all but Ontario, that negotiated a lower percentage of it being nonprofit. They can absolutely attach federal healthcare dollars to nonprofit and public provision of services. And we're saying they should absolutely do that, given particularly the track record of for-profit long-term care, where in Ontario more than 4,000 seniors died of COVID alone. Some, in addition, died of dehydration, starvation, of malnutrition, of neglect in long-term care homes. And for-profit long-term care homes had 5 times the death rate of publicly owned long-term care homes. And then also the terrible record of the for-profit surgical and diagnostic clinics. So stop for-profit healthcare and seniors care is the second key issue. Protect and expand pharmacare. That's the third key issue. So you may be aware that the federal government actually brought in essentially 4 new social programs, which is an amazing thing. It's been, almost a generation since we've had new social programs in Canada. And these social programs actually improve living standards for Canadians. They actually are a net gain for all income categories except for the highest income categories. So even upper middle class people benefit from these programs more than they pay into them, and everyone from the middle class on down, absolutely. And so we brought in a new pharmacare program in Canada, which covers right now drugs for diabetes and contraception. And the plan is to expand that program to cover more categories of drugs. So key issue is to protect what we've already won, which is the brand new pharmacare program, so public coverage for drugs in Canada, and expand it. And the fourth key issue is to protect and expand the dental care coverage, another new social program that has been brought in Canada. And so this is quite exciting. Right now, the new dental care program covers people over 64 and under 18. And it covers for basic dental care, it covers for preventative care, restorative care, a whole sort of set of necessary dental care. And the plan is to expand that program to other Canadians. As soon as actually May 1st, it's supposed to expand to people 55 years and older, and then on to the 18 to 34 age group and the 34 to 55 age group. So the key issue here is to protect what we've already won as Canadians or achieved as Canadians, and also expand it. So I'm going to pause right now. I'm going to move out of this slideshow, and I'm going to go to the questions for candidates. So we've created a bunch of resources. I'm just going to stop my screen share for a second, and I'm going to share a new screen with the questions for candidates and the political party tracker on these key issues. So everything kind of follows these, sorry, I'm just trying to find, here it is, these key issues that I've just run through with you. And so here we are. Sorry, it's starting in the middle of the document. So these resources we're going to send out tomorrow morning to everyone, okay? And they are printable versions that you can use yourselves. And so we've provided questions for candidates for all candidates meetings or when candidates come to your door. And they give a little bit of background, but they are those 4 items that I just went through with you. Uphold and enforce the Canada Health Act. So what we're asking is, what will you do to stop the private clinics that are charging patients for surgeries and diagnostic tests? Will you advocate to speed up the enforcement of the Canada Health Act to stop the, to ensure that the nurse practitioner-led clinics, the new nurse practitioner-led clinics that are charging patients directly for access to primary care, will you act quickly to stop those extra charges for patients? And what will you do to stop the virtual care? That's those online companies that are selling online access, to stop them from extra billing patients. For the pharmacare, so the expansion of public health care to cover drugs, the question is, will you commit to keeping what we've got? So the coverage for diabetes medications and contraceptives, and then also expand them, and on what kind of timeline? For dental coverage, as I said, now people under 18 and over 64 are covered. So the question is, will you commit to maintaining that? And will you expand it to cover the rest of Canadians as planned? And then on ending for-profit health and seniors care, again, quick briefing like the one I just went through with you. Will you commit to tying federal dollars to expanding and improving public and nonprofit healthcare, and not to expanding for-profit corporations? Okay, so those are the questions. They're pretty simple. And then I've provided a party tracker of the various political parties' records on these things. And so on upholding and enforcing the Canada Health Act, the Liberal Party has a bit of a spotty record on this. They haven't really acted with any strength in upholding and enforcing the Canada Health Act. They did issue a letter to the provinces, and there's a link in this document to it, that will require provinces to publicly fund those nurse practitioner clinics that are charging patients directly for services. However, that does not take effect till April 1st, 2026. And the letter itself took a very long time to be released publicly. So there's been a long delay, more than 2-year delay in this. That's really unacceptable. There's no reason for that. These services should be covered. They should never have been allowed to charge patients directly. They should have been publicly funded to start with, and this has to stop. And then there's really nothing in the letter to the provinces stopping the virtual care companies like Maple in Ontario that are charging patients for online access to doctors. And they really aren't doing much to stop the surgical clinics that are, or diagnostic clinics that are charging patients now literally thousands of dollars for access to things like in Ontario cataract surgery and so on. I'm going to stop my screen share for the moment because yesterday Mark Carney was asked directly about this in Alberta, and his answer was not very strong. And one of the things, if we're successful in this election, what we would do is really push very hard for a much clearer, much stronger answer from the federal Liberals on this issue. And so I'm just going to share my screen again to a video. Sorry, I'm just finding it, okay? From yesterday. Now, in fairness to Mark Carney, it was the end of an hour-long media conference. He may have been tired and he may well not have been all that well briefed on this issue, but still the answer is not where we want it to be. And I'm showing it to you because I really want people to pour on the pressure now, create the political space, and push the federal Liberals to a much stronger position on this. I'm going to share my screen and show you that video. I'm going to optimize for video sharing. Okay. And I'm sharing now. Okay, can you see that? Yeah? Okay, so I'm just going to get this back to the beginning of the question, and hopefully you'll be able to hear this.
How will you enforce the
Can you hear this?
Act when Alberta's government?
It's a bit low, but yes.
It's a bit low, right? It's low even on my computer. Okay, hopefully you can hear it. I'm going to back it up again, okay, and just try again.
Mr. Carney, how will you enforce the Canada Health Act when Alberta's government is promoting and funding more private health options? I know other provinces are skirting the rules as well.
We'll first off, I'm a believer in working with provinces. I'm a believer, again, I'm going to go back, broken record, but believer in results, getting results for Canadians. Obviously, we will work to ensure that all Albertans' rights, Canadians' rights, are fully respected in that. So, in a pragmatic way and a direct way, again, by working with the province in order to make sure that happens. Thank you.
Thank you. Mr. Carney, how will you enforce?
Okay, so you heard that, I hope. Sorry, it's a bit hard to hear. So what he said was, we'll work with the provinces. He said, we'll work to ensure that all Albertans' rights in that way are protected. He said, we'll work pragmatically. So he's sort of there. You can see if you want to sort of give him credit, but he's sort of not there. And, you know, the issue isn't working with the provinces. The issue is upholding and enforcing the Canada Health Act, which bans outright user fees and extra billing of patients. And so I wanted to highlight that with you. I'm going to go back to sharing my screen on the party's records on this. And so those people who are Liberals among us, you know, pushing for a better, clearer answer is good. Obviously, everyone's in a difficult situation with Danielle Smith as the Premier in Alberta. But, you know, nonetheless, we got to push and create the political space. We cannot lose the Canada Health Act. That's key. On pharmacare, while the Liberals brought in the expanded pharmacare program, actually it was the NDP that pushed them to do that. It was part of what was called the, oh my gosh, the, whatever, the agreement that they made to support the minority government, and that was that they had to bring in pharmacare. And so we've got the first partial step towards pharmacare with the coverage of diabetes medication and contraceptives. Dental coverage, again, they brought in this program, and the plan is to expand it. ending for-profit health and seniors care. The federal government announced 2.4 billion from 2023 to 2026 for home care and 3 billion from 2023 to 2027 for long-term care. So these are multi-year deals, $5.5 billion, but there are no strings attached to ensure that funding goes to public and nonprofit care, or, expanding and improving public and nonprofit care. The Conservative Party. So this one is, I think, key for people to understand. So on enforcing and upholding the Canada Health Act, as an MP in 2012, Pierre Poilievre voted to cut literally 43.5 billion in healthcare transfers to the provinces. That's massive and would have obviously resulted in, the removal of any kind of federal standards for healthcare. He has not to date made any commitment on stopping private clinics that are extra billing patients. On pharmacare, Pierre Poilievre voted against pharmacare when it was brought in. In 2024, he vowed to scrap the program. In the election campaign just recently, he's changed his tune, saying he'll keep the existing program, so that's coverage for diabetes, drugs, and contraceptives in place, but he's not committed to expanding it to cover other drugs. For dental care, it's the same story. So he voted against it in the beginning. He's spoken against it during the election campaign recently. He said he'd keep the existing program in place. So that's coverage for under 18 and over 64-year-olds, but he is not committed to any of the further expansions. And there's no commitment there to end for-profit anything. The New Democratic Party, the NDP has committed to upholding and enforcing the Canada Health Act, and in fact has fought on that quite a bit. They've specifically spoken out against provinces that are violating the act and allowing private clinics to extra bill patients and charge user fees. I'm worried I'm going a little too fast for Way. Are we okay? I can't see anyone, so
Maybe a little slower would be better. Just
slower?
a little,
A
yeah,
little
in
slower.
breath
Okay,
after sentences.
okay. On expanding Medicare to cover pharmacare, sorry, the words I couldn't find before, the supply and confidence agreement was the agreement that they made to support the minority liberal government. And one of the key issues was that they insisted on a commitment to bring in the Canada Pharmacare Act by the end of 2023, and then develop a national list or formulary of essential medicines, and do bulk buying of drugs by the end of the agreement. And so the commitment from the NDP is to deliver full public pharmacare within 4 years. Again, committed to keeping and expanding the dental care program. On ending for-profit care, the NDP has called for national standards in long-term care. They made a non-binding motion to call for Rivera, which is a for-profit chain, or was, to be turned into a public entity, and to transition from for-profit to non-profit long-term care by 2030. In this election, they've pledged to ban US companies from buying Canadian healthcare businesses. We couldn't find any specific commitment to tie federal funding to long-term care expansion in nonprofit and public ownership only. And the last but not least, the Green Party has committed to uphold and expand public Medicare. They haven't really made any specific, I couldn't find specific commitments on what they would do to enforce the Canada Health Act in provinces. They promised to keep pharmacare and expand it to all prescription medication. Similarly, pledged to keep the dental care program and expand it to cover all Canadians. And they actually made a commitment to ensure that all new federal health dollars go to public and nonprofit care. Okay, so those are the party commitments of the four major political parties on healthcare. I'm going to just go to the last part of my briefing and then we'll open it up for questions and answers. And this is on key messages. So I'm just going to go to share my screen again to, sorry, lost it. There we are, to the slideshow. Okay. So in this election, you may have noticed that the political leaders and parties are talking about the economy as though it's only the private sector. And I find that staggering because in Canada, the public sector is a huge part of our economy. We have a mixed economy. It's both public sector and private sector. And so things like public health care, public education, public parks and recreation, public courts and roads and transportation and, so on and so forth are all parts of the public sector and they're critical to our economy. In fact, if you think through the province of Ontario, towns like Kingston or Ottawa or Sudbury, even Thunder Bay, places all across the province, the public sector is actually the largest part of the economy in many of our communities. And so key message one is that public health care is an economic driver. It's not a takeaway. In many communities, public health care and public services are the major employers. They drive the economy. They provide employment and decent wages. They support families and businesses. They also provide a competitive advantage compared to the United States, for example. Other key thing is that public health care and other social programs mitigate the increasing income inequality dished out by the private market, so i.e. by employers. And so I think you all know that incomes have been becoming more unequal in Canada since about 1983. For an entire generation, more than a generation, incomes dished out by employers have gone skyrocketed at the top and have actually declined at the bottom. And the middle is pretty much stagnant. Public health care and social programs mean that we pay taxes based on our income. So the wealthiest pay the most, the poorest the least or none at all. And those taxes are transferred out in services and programs and income transfer programs for everyone. And they create equality. That's the economic mechanism of our tax and transfer system. It's critical for equity in this country. It is not a takeaway. And when they talk about tax cuts, those actually create more inequality. They're a takeaway for most people. They benefit the wealthy almost always. Almost all of the tax cuts that we've had over the years have benefited the highest incomes. So by collecting corporate and income taxes and transferring them out to all Canadians in free services for all, like healthcare and education, we actually increase the standard of living for the vast majority of us. I think we're going to have a big fight on this now. We're going to need to educate people because, Donald Trump just the other day said, for reasons unknown to humankind, we have they introduced income taxes as if it's a terrible thing. Well, if you're super rich, yeah, you don't like income taxes. Why? Because it forces you to share with the rest of society. They are not a takeaway. They're an income booster. That's a key message. Key message two sort of flows from that. So beware of service cuts masquerading as tax cuts. And I'm quite worried about these continual promises of tax cuts. They always talk about them as though they're going to benefit the middle class and poorer Canadians. And they always, to date, have benefited higher income people and corporations. And so please also remember that when people lose their jobs by the thousands, as they are now in this trade war, they need public services more than ever before to maintain their standard of living and provide protections against, total financial ruin. And tax cuts should really be called tax giveaways to the rich because that's really what they are. Key message number 3, a strong Canada rests on public health care. We're proud of who we are because at our best, our country has built programs like our world-class public health care for all. We should protect it and expand it, not privatize and dismantle it. And Canada is different than the United States. When we're at our best, our values reflect that. We believe in public health care for all based on need and not wealth and not private profit. We believe in peacekeeping and peacemaking, one of the key determinants of health, not on empire. We believe diversity is our strength, providing our society with all kinds of benefits. And we believe in a just society, social programs and services that create equity, reduce suffering, and support people to live to their human potential. Okay, key message number 4. I actually just want to stop here for 1 second and just share a recent video. Holy cow, it's dark in here. It got super dark in here. I'll turn on a light in a minute. But a video of Donald Trump recently, I just want to show it to you and then sort of deconstruct a little bit. And this is the last key message that I'm going to run through. So just 1 sec, I'm going to share my screen. And here we are. Okay. Oh, shoot. Sorry, I got to stop for a second. I have to optimize the video. Share my screen. Oh, it is. Okay, sorry. Here we go.
I took two things that I love, dancing
Sorry.
and dogs,
I have to
and I
let
made
the-
them into a successful business. Hi.
Canada, we'll see what happens with Canada, but the people of Canada would be paying less than half of the tax. If you look at the tax, they're going to be paying less than half the tax. They don't pay very much for military, and the reason they don't pay much is they assume that we're going to.
Okay. So this is, Trump sort of riffing on his plan to make Canada the 51st state, saying we would pay less than half the tax. And so my last sort of key message deals with some of the kind of false information there. So just a second. Okay. Sorry, just a second. Okay. So Donald Trump's message on taxes and healthcare is just dead wrong. Americans pay more than Canadians in taxes for healthcare, but they don't actually get it. It's just the travesty of the for-profit American healthcare system. So not only do Americans pay more in taxes for healthcare than we do, on top of their higher taxes for healthcare, they also have all kinds of out-of-pocket costs. They have to pay insurance premiums, co-pays, deductibles, and so on. And so do their employers. In fact, Americans pay double what Canadians pay for healthcare. They have the most privatized healthcare of any developed country. And that means there's profit taking at every level, much higher administrative costs. And even after spending all that money, tragically, Americans have worse health outcomes in the key categories, including higher infant mortality, shorter life expectancy, and others. And I'm just going to show you one last thing about that before I open up for questions and answers. So I just want to show you a couple of key slides and things, which I've made into videos, but I'm not going to share those videos tonight. We're going to send them out to you tomorrow, and then you can use them in your social media during the election campaign. But I'm just going to show you them quickly here. So the first one is that Americans pay more in taxes for healthcare than we do. And if you can see this, I'm going to zoom in, I think. Oh, it doesn't want to zoom in. Okay. If you can see this, you'll see the United States is at the top here. And the light blue part, 2,242.57, this is US dollars. That's what they pay in taxes for healthcare. Then 11,000 plus is what they pay out of pocket for healthcare. Canada is down here, $2,069 for publicly for healthcare. These are American dollars, remember, 4,944 out of pocket. And so so you can see we're paying far less for healthcare than oh, here it is, huge. How did that happen? Oh, I see what I did. Sorry. Than the United States. Sorry. And despite the fact that they spend almost 18% of their GDP, their gross domestic product, on healthcare, this is how they compare to other countries in key areas. It's probably better if I just show it to you here. Life expectancy, worst. Infant mortality, worst. Unmanaged asthma, middling towards the bottom. Unmanaged diabetes, worse. Safety during childbirth, worst. Heart attack mortality, close to the bottom. If you look at life expectancy by country from the World Health Organization, you can see this is a list of the top countries in the world for life expectancy. The US doesn't make it onto the list. Here's Canada here at 82.6 years. This is as of 2021. Using the same data, World Health Organization data, same year, US life expectancy, sadly is just 76.4 years. So much lower than many other countries. We already talked about life expectancy. This is, sorry, just quickly, obesity. It's the worst. And then there's one on administrative costs. Here we are. These are admin costs in the US health system. You'll see Canada is here at 219. The US is 1,001. These are per person. And these, I believe, are 2022 figures also. So the point of this is that despite the sort of crowing of Donald Trump and so on, I think it's since that's kind of all over the media, we should take this opportunity to actually counter some of the myths and misconceptions and so on. The other big one is that there are no wait lists. There's no wait times or wait lists in the United States, and there really are indeed lots of wait times and wait lists in the United States for healthcare. And so we're going to be putting out a fact sheet as well on that for your use. So the last thing I'll just show you is the sort of basic postcard, which you can print off yourself and distribute if you want election materials to distribute at all candidates meetings or even in your neighborhood. And this is what it looks like. This is the front. It says vote healthcare, talks about the economy mattering. But it talks about how healthcare is tied to the economy. Okay, and this is the back, and it's set up so you can just print it on a page, either in color or black and white. It's very readable, and these are the key issues and questions, and it's literally 2 sentences on each. So very easy for people to read and use during the election. So that's it for my briefing. I'm going to open it up to questions and answers now. Maybe we can take the spotlight off so I can see everyone. Debbie is going to watch the chat, so if you put questions in the chat. Otherwise, can you use the raised hand function? So if you are not familiar with Zoom, go down. Usually it's at the bottom of your screen. There's a toolbar. If you don't see it, move your cursor down and it will pop up, and you'll see towards the middle there's a thing with a kind of tipped on its side heart, and it says react. If you click on that, It's got an option to raise your hand. And then once you're done, you can lower your hand again. Give me 1 second. I'm just gonna go turn on a light because it's super dark in here. I'll be right back. Sorry, everyone. There we are. That's a little better. Okay, so questions or comments?
So,
Debbie.
so Natalie, a few questions on the chat. One is that there's quite a bit of referral to how do you make the provinces adhere to the Canada Health Act? How can the federal government be more strict with them, make them follow the plan? And also a question about how do they pay for the programs? If we extend pharmacare, how is that going to get paid for? Also, a question about the Liberals giving up the 2% increase in capital gains. Why did they do that when we could use that money? And one question is, what's the private per capita for mean for in Canada? Like, what does it mean? Someone's asking if you could explain what that means. And then a lot more about if you want to talk about the Health Act, like what have provinces done in the past? How has the federal government made them follow the plan and use the funding properly? Questions like that about what's happened in the past and what we can do going forward.
Okay, so that big set of questions around the Canada Health Act, it has been a fight. I mean, it really has been difficult for many years to get the federal government to act more decisively to uphold the Canada Health Act. I remember in the 1990s when the Alberta had elected the Ralph Klein government, like arch right-wing government. They actually imploded a hospital in Calgary to sort of show their plan to change, fundamentally change healthcare. And they brought in a bill to bring in private clinics, and people came from all over the province to protest and so on. And then they were allowing the private MRI and CT clinics to extra bill patients. And we held protests outside MPs' offices all across the country in solidarity. This is when the movement was very, very strong nationally. And actually, the Alberta Friends of Medicare, our counterparts in Alberta, collected the receipts from patients, thousands of patients who had been charged for their MRIs and CTs in these private clinics. And the federal government ultimately, the Alberta government paid back all of the patients who'd been charged for medically needed MRIs and CTs. And the Ralph Klein government actually rolled them back into the public system. It was quite amazing. And famously, Ralph Klein called public health care the electric third rail of Canadian politics. I've told this story to some of you, you may have heard it, but I love that. So it's that when the train goes down the tracks, there's the two rails that the train goes down, and then there's the electrified rail, and you dare not touch it or you would be electrocuted. And I always thought, our role is to electrify that third rail, make them afraid to touch our public Medicare, dismantle our public Medicare. And so really when it's been upheld, like in Alberta or in Quebec, where a seniors movement threatened a writ of mandamus, which is a legal action against the federal government. This is in Quebec. It was a French-speaking seniors movement, went to the federal government, threatened a writ of mandamus for failing to uphold the Canada Health Act in Quebec and stop the private clinics from charging extra user fees and extra billing patients. The federal government met with the Legault government. They wrote to the Legault government and they met with them, and they really put pressure on them, and the Legault government brought in regulations to stop what they call the ancillary charges or the user fees in the private clinics in Quebec. So public pressure has been what has pushed the federal government to take action when it's taken action. In 1995, Diane Marlowe wrote a letter to the premiers stopping them from allowing extra user charges in the standalone clinics. So when they moved services out of public hospitals to the standalone clinics, the clinics were charging patients, and so she wrote to them and upheld the act. So it's really dependent on who's in government, whether they believe in public Medicare or not, whether they're really going to take action or not. The key words to look at when they say that they're going to work with the provinces, well, no, we're not negotiating with Danielle Smith whether or not they're going to have private clinics extra billing patients. No, the federal government's job is to uphold the Canada Health Act. If Alberta lets its private clinics extra bill patients or charge user fees illegally, the federal government is supposed to claw back the funding that they receive and do it very, very publicly, and publicly pour the pressure on the premier to come in line with our public Medicare laws. Similarly, in Ontario, where Doug Ford is, turning is absolutely facilitating, not just ignoring, but allowing and enabling private clinics to charge patients extra user fees. The federal government has a role in pushing Doug Ford and clawing back the funding and pouring the pressure on to stop the extra user fees in the private clinics. And so the provincial government has a role. Yes, the federal government also has a vital role, and we need to push both of them. I hope that answers that question sufficiently. But if there's more on that, I can come back to it. How to pay for pharmacare? Well, like the Americans who are paying for public health care but don't get it, they're literally paying double what we are for healthcare per person, and only they don't get it. We are paying for pharmacare, but we don't get it. We're paying more for drugs than we would if we had a national bulk buying system, because of course then you've got, bigger buyer, like, the LCBO, for example, and you can negotiate the prices better. You've got a bigger market to negotiate the prices, and have a formulary of safe and effective drugs. The calculation done by, oh gosh, Jean, what's his name? I'm having a terrible day today. Anyway, the sort of key expert on this was that it would save $10 billion to bring in national pharmacare. So that would be transferring from, all the for-profit insurance programs, out-of-pocket drug costs and so on, to a public program. It's cheaper than it is to pay privately. So the question of could we afford it? Well, we're already paying it. The question is how we pay it, and whether or not we then provide equitable coverage, like the same kinds of principles that we have for public Medicare applied to drugs, right? So now a lot of people in Ontario, you face co-payments and user fees under the Trillium Drug Program. If you have extraordinary drug costs, it's indexed to income, so you have deductibles and so on that you have to pay. And the idea would be to have a national pharmacare program where you don't have deductibles, where you do have equitable coverage, bulk buying, and a safe, effective drug formulary. So a list of drugs that would be covered, and it actually would be less expensive than what we are doing right now. The capital gains question, so like why did the Liberals cut? Well, because there was a big blowback on the capital gains tax increase that they had brought in. So that's why they did that. And then private per capita. Okay, I don't know if the question is that people just don't understand the language. So per capita is per person. So when we talk about per capita healthcare spending or funding, it's per person. And private is what you pay out of pocket, and public is what we pay through our taxes. Okay, I hope that answers that question. Okay, now I'm going to massacre your name here, but I think it's Chabi. Do you want to go ahead?
Yes, I have a question. Like one of my friends said that they are seniors, and to get the refill, the doctor had charged them $100 or so. And my son was telling today Like the secretary asked them for any prescription, do you want to pay by cash or by check? So, why are they doing this?
So if a doctor charged $100 for a doctor's visit
Not the visit, to write the prescription.
to write a prescription, they can't do
No,
that.
I know.
Okay,
Then my daughter-in-law said, "Well, let me ask you, let me ask the doctor." And then the doctor said that, okay, you don't have to pay. So what is this? That means they are charging money. Whoever doesn't pay attention, and they are getting in their pocket. And
that's
that
right. Yeah, that shouldn't happen.
I know this is very bad. And one of my friends, they are seniors, and for last 2 years, the doctor has been charging them for prescription and refill.
Okay, so there is a thing. So what may be the confusion here, and I'm not saying it is, doctors are allowed to charge block fees. This was something that was brought in by the Mike Harris government in the 1990s, and that's for medically unnecessary stuff like phone in prescriptions. So if you go into the office and you get a prescription, that's fine, it's covered by OHIP. But if you have phone in prescriptions, they can charge you for that. Usually it's $10 though, not 100. They're allowed to charge a block fee for all the medically unnecessary stuff that you may get in a year. That could be like camp physicals for children, or work physicals, or things. Wait, let me finish if that's okay. Things like that that are not covered by OHIP because they're not medically necessary. Those block fees, say they charge $100 for a year for them. I mean, in truth, if you don't use all of those medically unnecessary things, they should be returning it. But in addition, they're optional. You do not have to pay. And if you do have medically unnecessary things like phone in prescriptions, you can pay per item, not a whole block fee of $100 for a year. The best thing to do in this situation is just have your friend email or call us and we can help them. And if they've been unlawfully charged for anything, they should be able to get their money back. And they can make a complaint to OHIP, and maybe it's on our website, the phone number and email address under the OHIP section. Maybe Genevieve, if you're here, or Sala, can you check and just put that in the chat? So people can make a complaint directly to OHIP, or they can come to us and we can help. Okay, I'm going to go back to federal election issues though. Thank you very much for your comment. Any other questions or comments? Shailen, do you have questions in the chat? Everyone's good? Okay. You're good? Okay. Did I miss any? Holy cow. Okay, well, it's pretty straightforward, right? Those 4 key issues. So what we have is a bunch of videos, internet shareables. It would be the best thing ever if you can share them on your social media. If you have social media, Facebook, Instagram, TikTok, X or Twitter or Blue Sky or Threads, any of those things that you're using, by email, etc. We have printable stuff, and then we've got the questions for candidates, and all of it will go up on our website and also be emailed out to you in the morning. So you should have all of that. I think that's everything that people would need, right? Is there anything else that you need? Okay, Jean. Oopsie, you're on mute.
Okay, so what do we do, Natalie, with this election? Do you vote strategically? Do you vote on what's most important in your life? What do you say?
Well, me personally, I always vote my conscience. I don't believe in,
Okay.
strategic vote. I just feel like it's it's a very it's a thing that can be easily manipulated. But we don't, at the Health Coalition, we're nonpartisan, so we don't tell people how to vote, and you have to sort of make those decisions yourself. I think for us, what is something that people can do that makes change is really create issues. Like if everyone is amplifying the issues on social media and through all the channels you can, door to door and in all candidates meetings, the pressure actually builds on the parties. There's a reason why Pierre Poilievre has changed, from saying that he was against even the small mini step that we have towards pharmacare in Canada to, I'll keep that, but I'm not going to expand it any further. That's because he thinks it would be politically devastating to say otherwise. So that political pressure that we can create really does make a difference. Obviously the Liberals are leading now in the polls, so we want to get some clear commitments from Mark Carney and the Liberals on upholding the Canada Health Act. That's key. And if you're a Liberal and you've got a riding association or in any way that you can push within the party, absolutely do it. For those of you who are not, in all candidates meetings, door to door, in every way possible, push, 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 push on those key issues. That's, those things are super effective. And then, how you vote. Oh, it's a hard one, but I can't give you any advice from us because we don't take a position on that. And you know what? It would be devastating to the coalition, right? There's no agreement at all. It would just completely divide the coalition if
Right.
yeah. Thanks
Thank
you.
you.
Okay, Ross and then Matthew. I should say we also have members from like
If
at
I,
least 5 different political parties that I know of in the coalition. So, it's important that when public Medicare came into being, when the Canada Health Act was passed in Canada, it was unanimous. It was passed unanimously by all of the sitting parties in the House. And the more recent sort of movement away from supporting public Medicare by the Conservatives is much more recent, and it would be good for us to get back to not having to just fight for the life of public Medicare, but actually to move on to improving it. Although we have actually remarkably won some expansions of it recently, so that's cool. Okay, sorry, Ross, go ahead.
yeah, no problem. If I could just go back quickly to the pharmacare question, how to pay for it. And I think the study you were referring to is by a guy called Marc-Andre Gagnon.
Oh, thank you.
You're welcome. I know I wouldn't have been able to sleep tonight unless I figured it out either. Anyway, I couldn't find that study, but there's been a recent one done by the Center for Policy Alternatives, which looks at the savings from pharmacare and how it would be publicly delivered and in a manner which is completely fiscally sustainable. And I put that link in the chat.
Oh, lovely.
Yeah, it's a more recent one, so it's actually probably better than Gagnon's work, and it's done by David McDonald at Queens and
Okay.
Andrea
And do
Dutton.
they find, like, as I recall, his Marc Andre, who actually, I know him personally. I can't believe I couldn't remember his name.
Yeah, I know.
I think he found that it would be $10.2 billion less
That's
expensive.
right. That's right.
Does their work find similar?
Yes.
Okay.
Yeah.
Okay. Thank you very
It
much.
builds on that and it puts it in the current context. Yeah.
And that's sort of both, making the coverage public, so non-public, nonprofit, also paying for safe and effective drugs, and bulk buying. That's how they found those things. Thank you, Ross. So I've got Matthew Caventer. Oh, you're on mute still, Matthew. Are you able to unmute? We'll give it one more second, then while you're trying to unmute, we'll go to Debbie and then come back to you, okay? So, Matthew, oh, he disappeared. Okay, we'll go to Debbie and we'll come back to Matthew if he gets his mute stuff sorted. Go ahead, Deb.
Okay, Natalie, just a couple more questions on the chat. One is, when did OHIP last set fees for doctors in this province? And another question about candidates, when they won't attend or they won't cooperate at debates or meetings, do we expose them, or what do we do to show the public that they're not interested in hearing from us?
The last OMA agreement. So the Ontario Medical Association negotiates with the government. And the last one was recent. I'm just trying to find the actual date, like within the last year. I don't have the exact date, but it was recent. And so those negotiations set the fees schedule. Actually, very sadly, they also, historically resulted in the, defunding the non-coverage of audiologists and chiropodists and things like that. That was part of the OMA agreements, which I don't think is right, but yeah, so the funding, the OHIP schedule of fees is negotiated in those negotiations with the doctors, with the Ontario Medical Association, which is the doctors' lobby group and sort of union, I suppose. And sorry, what was the second thing?
It was about candidates. What do you do when candidates refuse to attend an all candidates meeting or won't participate or listen to the public? And should they be exposed, or what should we do about that?
Well, for sure you should expose them, yes. But I mean, if you're doing all candidates meetings, you got to do your job of organizing them, of organizing to get people out. So, because it's pretty embarrassing to shame a candidate for not coming to an all candidates meeting and then only have 20 people at the all candidates meeting. Usually, everyone here is very good and gets several hundred people out to the all candidates meetings and so on. But if you're not going to do that, then it would be kind of embarrassing to hold a press conference and tell them off for not coming, right? So do that. Do our job of organizing properly, and yes, definitely expose them. It's undemocratic for them not to come. Anything else? I do have a suggestion though. If you're organizing them, it is much better to do one riding than to do 5. Like if you're a candidate, to have 20 people at an all candidates meeting, 20 candidates, and you're trying to ask them questions and they've got 2 minutes to answer. And if you have 4 parties or 5 parties, that's 10 minutes of answers for each question, at least for one candidate. You might fit in an hour and a half, 6 questions or something like that, maybe 7 with introductory comments and closing comments. I mean, you don't fit that many questions in as it is. If you have 20 candidates, because you've got 5 different ridings there or something, it's brutal. I mean, really, it's better to do one riding at a time if you're going to do that. Matthew?
Thank you. I'm I want to just point out that something that you pointed out, that having a minority government was critically important in getting the things we need, having the balance of power with the progressive element. So I'm only speaking to those people who might be supporting the NDP or in terms of action. I've been canvassing for the NDP. I want to be careful. I'm not saying the health coalition should be, but there are those of us who are. And I want to say, number one, it's important to get that across when canvassing that. And we've made a difference. And there are 2 points of that. Number one, in ridings where it's between the NDP and the Liberals, then we have an important point to make that is a major that it makes a big difference in terms of the power structure of society to make sure that there are enough NDP seats to maintain some meaningful direction to the government, to a progressive and especially progressive healthcare policies. And the second thing is, in those ridings where a liberal is absolutely it is unlikely to be defeated, it is important to get as many votes out for the NDP so that that the vision, that the values that we hold, that is being proposed by the NDP or been enacted by the NDP to get to be heard and seen to be valued in our society. So I'm sorry if I've spoken out of turn because I really know, you know how strongly it is when I've been in leadership positions in the Health Coalition, that we have to keep nonpartisan. So I want to be clear again. I'm only speaking to those of you who may be acting in support of the NDP.
Okay, yeah, thank you, Matthew. And I appreciate you being sensitive to the nonpartisanship of the coalition. It's a tough situation to be in. There's a lot of talk often about things like parties combining and this and that, and we don't take positions on it. But I do have to say, like, look at what's happened in the last few years. We actually have had 4 new social programs in this country. You know, the child benefit, the big expansion of the child benefit, child care, dental care, pharmacare, and it's been like an entire generation without new social programs. Obviously we had the Charter of Rights and so on, but that was, going back now 40 years. It's been a long time since we've had any big leaps forward in these things that create equity. They're so important to the country, to people in the country, and to mitigating this ever increasing inequality that we're seeing. I mean, the last generation, we saw almost all of the economic growth of the entire last generation has been taken by the top 2 income categories. So they've taken much higher incomes for themselves and not passed them on to the middle class, or the poor, to the people below them. And that is the truth of it. And there's a couple of ways to get at that. One is by you reducing the income inequality dished out by the private marketplace, but the other is by redistributing it through programs and services and income transfer programs. They're critical to our country. I'm very worried so I'm just sort of going on about this a little bit, but I hope people hear me. I'm very worried about this talk about program reviews and spending cuts at the federal level in this context. And after just finally having broken out of years and years and years of austerity and not actually making any leaps forward in these things, the talk about sort of retrenchment now is very worrisome, particularly just as people are going to need more. And when we have a real housing crisis and other things in this country that we need to deal with through some public solutions. So anyway, thanks, Matthew. Manisha, sorry.
Hi, thanks. I did speak to my Liberal MP, Nathaniel Erskine Smith, about healthcare. It was a little while ago, and he said the only thing that the federal government can do is claw back some of its funding, which he felt was not very effective, and it reduces the amount of money overall for the provincial healthcare budget. So he kind of shrugged his shoulders. It was a bit dispiriting. He seemed to suggest that there was really nothing that they could do at the federal level. Are there any other mechanisms that they can use to put pressure on,
I'm glad that
provinces?
people keep coming back to this question, because clearly I got to put something together and put it out on this. The federal government has historically done way more than that. They have publicly exposed provinces. The Canada Health Act is both kind of a moral, holds a lot of moral power in the country. And then the concrete mechanism of clawing back the money obviously matters as well. But I mean, mostly it's moral suasion, that they have. The federal government can put pressure on the provinces by exposing them. It can claw back money. It can, write much more stern, very public letters. It can, speak over the heads of premiers to the people in provinces about issues like this. And I can go through kind of the historic things that have happened when federal governments have done a better job of upholding the Canada Health Act and enforcing it, and maybe put something out on that. I'm looking at Russ because he's got I think, a comment or a question on that. Do you want to weigh in on that? And then Deb will come back to you.
Yeah, thanks. No, I just wanted to come to a point that you made before. We do have a history of the federal government tying federal money to the provinces for nonprofit healthcare. And that goes right back to the 50s and 60s. And that's part of what built the nonprofit laboratory diagnostic system and the nonprofit hospital structure, was the Fed saying our money will only be used for the nonprofit system. So that history is there. And that's one thing that's very powerful that the Feds can do.
Right, and they just did it with the childcare, with the daycare.
Absolutely. Although that,
National
yeah, the
office.
provinces are trying to sabotage that, but they did the same thing with the childcare.
That's right. So, I mean, we have a very recent example of that, you know, attaching federal funding to public and nonprofit. Of course, when things are public and nonprofit, they don't have an interest in charging user fees in the same way. The
Yeah.
for-profits want to charge user fees. They want to bill OHIP and bill on top and charge patients on top because that's how they maximize their profits, right? And
I
that's,
just say
they've
too,
always wanted to do
yeah,
that.
I would be a
Sorry.
little rude to Erskine Smith because he should know better. He should know that there is actually positive things the feds can do. And that's just a cop out to say there's nothing that can be done.
Thanks. And Ross, by the way, is our chair, our board chair, and also an expert on the privatization of the labs. He wrote a book called False Positive on it. So thank you, Ross, for sharing that history. Okay, Deb, to you, and we'll take the last questions from you, and then we'll wrap up. Oh, Matthew, sorry, did you want to make a comment? We'll come to Deb in 1 sec. Matthew, you go first, and then I'll come to you, Deb. And then we're going to wrap up.
Thank you. I just want to quickly talk about universality. My understanding is that Mr. Carney has indicated that he is only interested in expanding services where they can direct the money to the people most needy. And that would make it go farther. And I want to just state my opinion and my observation over many years that universality is a critical component in making sure that people do have access to services. Their situations change, the critical conditions that occur in their lives change, and government reaction cannot be quick enough to deal with it. But more important is the jealousy factor. If you only have selective people getting help, those who are not getting help say, why am I not getting the help? And it breaks down the value that healthcare is a right for everybody. And we see that. Where do you put the line of who gets it? Oh, all of a sudden, it becomes a barrier for people, and it creates jealousy. So it's part of the philosophy, the ideology of private enterprise, which we need to resist.
Okay, yeah, for sure. Matthew, can you send me if you have, I haven't seen that of that Carney saying that, but can you send it to me if you find it? And on universality, just so people can understand, in case you don't, what that means is that you have access to healthcare regardless of your financial or health status, right? So judge and janitor, as they say, would share the same hospitals, you know, and therefore the judges of the world would have an interest in high quality public hospitals, and not just you know, the system like you have in the United States where you kind of have the Cadillac of care, as they call it, for the wealthy, and then, you know, completely overburdened county hospitals and things like that. And so this idea of universality is cornerstone to education and healthcare, although not other social services in the same way. We did used to have a Canada assistance plan cap, which required some fundamental basis for income in the country, but that's gone. But if that's at risk, for sure we need to push on that. And one of our pushes on the pharmacare plan and the dental care plan were that they would follow those principles. First dollar coverage, so no user fees, no extra billing, and universal programs. Okay, so Ken, do you have a comment? I want to wrap up, so very quickly, and then I'm going to answer Deb's questions. Go ahead, Ken. I think you have to unmute, my friend.
Yeah, okay, sorry, I'm sorry I'm so late doing this, but while you were talking, I was scrolling down the Liberal priorities. They got, I think, 12 of them here, and there's no mention of healthcare in any of their priorities. They're asking you to select what's most important to you as a voter, and not one mention of healthcare there. Unfortunately, we're caught with the lesser of two evils here, unfortunately, and that's the problem. Anyway, keep up the good work again, and sorry for being so late with the question.
No, that's okay. Thank you very much. I mean, definitely this election is focused on international affairs, right? And so I think we all understand that. And but there have been now some healthcare questions, so let's try and push this into the agenda just so we force some commitments in the next few weeks. Debbie.
Okay, I don't have lots of comments on the chat, but there's only one question that I think you probably should respond to. Somebody's asking why you don't run why you don't run the Liberal Party, Natalie. So I know the answer to that, but maybe you want to tell people how that party's probably too far right for your thinking, I would guess. But you
Well, you know what? I actually there's in my experience at the Health Coalition now, for all of these decades, we've actually amended every piece of healthcare legislation, every major piece of healthcare legislation in the last 25 years in Ontario in the public interest. We've won like major change to legislation, and there's a role for social movements in creating political space. You know, the kind of role that would, create political space for a federal government to crack down on a Danielle Smith in Alberta, for example, or to crack down on a Doug Ford in Ontario when they're violating our Medicare laws. So political parties have a role in the political process. Opposition parties have a role in the political process, and sometimes social movements can create more social change than sometimes political parties can. And certainly we have, to my enormous pride in all of these years, I said I would leave like when there was sort of the crisis was over, and then the crisis never ended. So I think I'll stick around for a bit if you don't mind. But thank you to all, and it's all of us together that have managed to do that. I should say we've changed every piece of legislation up until the Ford government, and they actually have not amended any healthcare legislation at all since they took power. It's just unbelievable. I mean, they've made their own amendments, but they haven't taken any amendments from the opposition at all since they took power. It's unbelievable. But for all of the years previous, we have, and in very significant ways, we stopped the closure of hospitals, town after town after town. We stopped privatization every time, privatization of surgeries and diagnostics. We've stopped two-tier Medicare over and over. We've won improvements in long-term care. We've stopped the privatization in the P3 hospitals, a huge amount of it. We've won increased funding, all kinds of things. We've won democratic provisions in legislation and disclosure of things and all kinds of changes in the public interest over the years. So quite happy doing that. So thank you though for that, for the question. So with that, on the note of hope, it's always good to end with some hope. What we do actually changes the world, and thank you so much for doing it. And so we'll set off with all the materials tomorrow morning, and let's do everything we can. We've got, what do we have? 18 days left. So vote early. Don't vote often, and let's try and make as much of an impact as we can in the next 18 days. Shulin, thank you very much. A big hand and special thank you to Wei, because I talked way too fast. And thank you all of you. Talk with you soon. Have a wonderful evening.